Good day, my dear students. Welcome to our class on bioethics and sexual ethics. The topic for today's lecture is about the specific principles of healthcare ethics. Last meeting, we discussed about the general principles of ethics. And now we study another set of principles, and this set of principles are applicable to healthcare ethics or to bioethics. We will talk about the 8 specific principles: principle of respect, principle of justice, principle of solidarity, principle of nonmaleficence, principle of beneficence, principle of autonomy and informed consent, principle of truthfulness, and principle of confidentiality. Let's go to the first principle, the principle of respect. The principle of respect says the human person ought to be respected always. Why do you think persons are to be respected? Do we respect persons because of what they have? Possessions, money, riches? Do we respect persons because of what they do? If a person is an owner of a big business chain, if a person is a person of authority, is that enough reason to give them respect? We respect persons not just for what they have, not just for what they do, but for what they really are. A human being. And that in itself deserves the respect. Why? Because we are different from all other animals that God created. And we were created in the image and likeness of God. We possess human dignity and we have human rights. And the first of all rights is the right to life. That is why part of the principle of respect is the respect for life. Respect for a person's rights entails respect for her or his right to life, which is the most basic right. Human life ought to be defended from the moment of conception to natural death. Respect for patients as persons would tell us patients ought to be treated not as objects but as subjects, not as means but as ends in themselves, not as an it but as a he or she, or better, thou. Kant's categorical imperative says, act in such a way that you always take humanity in yourself as well as in every other person as an end, never as a means. Remember, Kant's categorical imperative says that this principle applies to all rational human beings. This is a universal truth, universal principle, and it is our duty to observe it. No one is exempted from observing this principle. And in the field of bioethics, part of the respect for patients is to treat them not as objects to be used, but as subjects, persons to be respected. That is the principle of respect. The next is the principle of justice. And the principle of justice says, give to each person his or her due, that is his or her rights. The principle of respect for persons is connected with the other ethical principles, which I'll talk about later, and particularly with the principle of justice. Justice is both a principle and a virtue. As a principle, one should give what is due to another. As a virtue, it is the readiness, the disposition to give what is due to another. So for a just person possessing the virtue of justice, it is very natural and not difficult to practice that principle because the readiness, the disposition has already developed in that person. The principle states that equal cases are to be given equal treatment. In healthcare ethics, justice applies by giving equal treatment to everybody without any discrimination. We go to the next principle, the principle of solidarity. And the principle says, love all persons, principally the most proximate and the needy. The principle of solidarity is related to the principle of justice. And the principles of justice and solidarity would help us in cases regarding the distribution of limited resources. So for example, if a hospital has a 200-bed capacity for patients and there are 300 patients, how will the management handle the situation? One approach is to set a category, which patient is in a more serious condition and therefore needs immediate attention. So this principle of solidarity would help us address those kinds of situations. Now let's go to the principle of non-maleficence. What does non-maleficence mean? Etymologically speaking, non is a negation. Maleficence came from the Latin words mal, meaning bad, and the verb faccio, meaning to do or to make. If you combine the two, maleficence, it means to do something bad. Non-maleficence means do not do something bad. And the principle states primum non nocere. First, do no harm to the patient. And this is part of the Hippocratic Oath, which says, I will use treatment to help the sick according to my ability and judgment, but I will never use it to injure or wrong them. So this is part of the oath that doctors make at the start of their practice in their profession as physicians. Next is the principle of beneficence. Etymologically speaking, bene means good, faccio, to do or to make. If you combine the two, it means do something good. So the principle of beneficence says, do good to your patients. If you cannot do something good to a patient, at least do not harm him or her. In the field of healthcare ethics, the physician should always strive to improve the health condition of the patient. One ought to do good to the patient, and the statement is a clear indication against euthanasia or mercy killing. If you cannot do something good to a patient, do not at least harm the patient, because one must always strive to work for the good of the patient. The next is the principle of autonomy and informed consent. Now, autonomy comes from the Greek words autos, self, and nomos, norm. It refers to self-determination. The principle of autonomy and informed consent emphasize the right to a true and free choice. Well, the principle of autonomy says that we are actually the ones responsible for our health. No therapy, no medication, no procedure may be administered to the patient without the free and informed consent of the patient. And the physician should always respect the rational decision of the patient as long as the patient knows the consequences of such action. The principle of autonomy and informed consent is a process in decision-making, which is a shared decision-making between the physician, the patient, and the family. However, the patient with the family is the one deciding with finality, not the physician. So, it tells us that in the process of decision making, the physician only recommends or informs the patient and the family of the medications, the procedures the patient needs to undergo, to improve his medical condition. But at the end of the day, the one who decides which procedure, which medications are to be given to the patient is the patient himself or herself, the patient with the family. The physician only recommends, but the physician does not impose. So, indeed, there's a saying, doctors know best. They know best in terms of the medical condition of the patient, but patient also knows best the values of the patient, the family, and especially when his health and life is involved. The patient is the one that decides which medication, which treatment must be given to him. The principle of informed consent tells us, inform your patients about their state of health so that they may give you free and informed consent to a particular kind of treatment or procedure. How is the principle of autonomy and informed consent carried out? So first, the doctor should inform the patient of the state of his medical condition, his diagnosis, the treatment or procedures the patient needs to undergo, the risks and the benefits. And it is the doctor's responsibility to explain it in a way that the patient would understand it. The doctor must not use terms that would be difficult for the patient to understand. And at the end of the day, it is the patient who decides, and the patient must be free. He must not feel forced to decide which treatments, which medications should be given to him. So, what about proxy consent? Proxy consent applies in cases when the patient is incapable of making a decision. So, for example, if you have a relative, in the hospital, and your relative is in coma, meaning he is in a state of deep sleep, and no one can talk to the person, and here comes a doctor telling you these are the procedures, the medications that the patient must undergo to improve his health condition. Who decides? Since the patient um, is in coma and unable to make the decision, the one who makes a decision is the closest relative. So proxy consent informs the closest relative or guardian on the patient's state of health so that he or she may decide with the physician on the course of medical action. But we need to take note. Proxy consent centers on the best interest of the patient, not of his or her family, nor of the physician. The surrogate or proxy substitute consent should be geared towards what the patient should have chosen if he or she is able to make a decision. So, the one giving the proxy consent must also think about what decision, what treatment, what procedure will 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 help the patient improve his medical condition, and the consent must be geared towards that. The proxy consent um, cannot be used to do decisions that would harm the patient, because it should always be on the best interest of the patient. Now, is the principle of autonomy and informed consent absolute? Well, autonomy is not absolute. It is limited with the principle of stewardship. It is limited with the principle of solidarity. So in cases when um, the patient would make decisions, would insist on his or her own will, but it would go beyond the practice of principle of stewardship and solidarity, then um, autonomy is not absolute. There's always a limitation in the practice of autonomy. It's limited by the principle of stewardship and the principle of solidarity. Like for example, if I am a patient and I was admitted to the hospital because of a certain medical condition that is curable, and I told the doctor, no, I will not undergo such procedure because I don't want to. I want to die. Now that is against the principle of stewardship. So the principle of autonomy before consent does not apply in this case, because we should always practice autonomy and informed consent with the principle of stewardship and with the principle of solidarity. Now go to the principle of truthfulness, and it says, tell the truth to the patient's or respective representative on their state of health or illness. In order for the patient to give an informed consent, they need to know the truth about their medical condition. And we need to tell the truth always, except when it is harmful to the patient, and until truly harmful to the patient. Lying is wrong, and truth to be told also to terminally ill patients, but prudently and compassionately. So we need to tell the truth to the patient, so that we may not lead the patient to false hopes. But the timing of telling the truth is also important. If we think telling the truth to the patient would cause harm to his or her medical condition, we can postpone telling the truth, or we can gradually prepare the patient to accept the truth about his or her medical condition. The point is, we need to tell the truth always. It is not about to tell the truth or not to tell the truth. We need to tell the truth, and the right approach is we need to assess the situation of the patient and gradually prepare the patient to accept the truth about his or her medical condition. The next principle is a principle of confidentiality, and it says, keep professional secrecy. Well, this confidentiality is part of the Hippocratic Oath. Confidentiality came from the Latin confidere, meaning with trust. It represents a relationship of trust with another person, which means to say that everything that happens between the physician and the patient must observe this principle of confidentiality. Now, is the principle of confidentiality absolute? If you remember, in the sacrament of confession, there's what we call the seal of confession, the confidentiality between the penitent and the priest, and that is something absolute. But in the principle of confidentiality, it is not absolute. Why? It is limited by the rights of others. If it includes a threat to the common good of the people, then the principle of confidentiality does not apply. For example, let us look at this case. CM, a 28-year-old male, had herpes genitalis, a sexually transmitted disease. With treatment, he had long periods of remission, and the next month he will get married to his partner, and he does not want to inform his bride regarding his disease. Should CM tell his bride? And what if CM refuses? Does the doctor have the duty to do so? In cases like this, can we apply the principle of confidentiality? Well, we need to look at the facts. herpes genitalis, well, of course, it is not a life-threatening disease, but it is a sexually transmitted disease. Should CM tell his bride? Yes, he should tell his bride about it because he can be a source of infection. What if CM refuses? Does the doctor have the duty to do so? Okay, in cases like this, the principle of confidentiality does not apply. Meaning to say, if CM refuses to tell his bride of his sexually transmitted disease, the doctor has the responsibility to inform his bride of the medical condition of CM, because the bride might get infected if they engage in the marital act after the wedding. But perhaps a better approach would be the doctor must convince CM to disclose his medical condition, to disclose his sexually transmitted disease to his bride, so that the bride is informed, so that the bride might not feel that she is deceived by her husband. So in cases like this, since it involves the good of another person, then the principle of confidentiality does not apply. Okay, that's our lecture for today. Please take note of your assignments. We'll be giving you cases where you can apply the principles we have discussed today. And see you next week for our next lecture. Have a good day.